Hi, this is Lindy. I want to share with you some key findings from our research done with colleagues in Malawi and London. For years, government leaders across Africa, Asia, and South America have been asking the crucial question: how can social innovations be integrated as part of national health systems? The challenge faced is that government processes are often tightly defined, making it difficult to incorporate new citizen-led ideas. But Malawi's experience proves that it can be done. In 2018, the Malawi Ministry of Health took an important step. They decided to institutionalize Chipatala Cha Pa Foni, a free nurse-run telephone health service, into the national health system. CCPF started as an idea from a young Malawian citizen and was developed through a partnership between Village Reach, a non-profit, the government, and other multi-sectoral organizations. The service connects people across the country with trusted health advice, improving access to care even in the most remote areas. To understand how Malawi successfully institutionalized this innovation, we conducted an 18-month study that included 68 interviews with 54 stakeholders involved in the project, first-hand observations, and reviewing key documents and evidence on CCPF. We analyzed our findings using two key perspectives: how institutions change over time, and the presence of positive organizational practices. So what made the difference? Well, our findings were clear. Institutionalizing social innovation doesn't always require money, but it does require a sensitive approach. Positive management practices were essential. Here are the practices that helped the Malawi Ministry of Health achieve their goal. First, prioritizing relationships. The team invested in building high-quality relationships with everyone involved in this innovation. They showed respect, appreciation, and recognized the value of each person involved. Importantly, they empowered others to step up as leaders within the process. Second, providing collaborative experiences. Rather than simply sharing updates or reports, the team gave decision-makers a direct experience of the innovation. Additionally, once a month, everyone gathered to share their input, ideas, and concerns, regardless of their rank or role. Number 3, cultivating hope. The team comprised of high-hope individuals. These hopeful people nurtured hope in others around them, and this enabled the team to persist and remain determined even when challenges arose. Their belief that Malawi could lead the way in a national health innovation was contagious, and this inspired broader support. Number 4, leveraging cultural identity. The Malawian cultural value of Ubuntu played an important role. It values the collective effort and inclusion of all people. And this ensured that all the voices were heard and respected, even when timelines had to be adjusted for meaningful participation. So here are some key takeaways for those among you who may be leaders or decision makers. Believe that it is possible. Innovations can be integrated to strengthen your national health system. Money helps, but it's not always the key. Adopting simple, positive management practices can go a long way. Collaboration enables institutionalization. Bring together policymakers, frontline workers, and communities to generate creative strategies with you and build a broad-based support. And remember, people are your greatest asset. Engage, appreciate, and empower, especially those hopeful individuals from every level. By applying some positive management practices, you as a leader can integrate locally generated innovations into your health system, and in so doing, lead to more resilient, inclusive, and most importantly, localized care. Be sure to read our paper if you'd like to learn more.